Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
He loves cords and shoelaces. He's gone through so many shoelaces that I've had to buy so many because he pulls on them or pulls them on his mouth. I don't know what to do. He reaches everywhere I put them. He's been acting up a lot, hitting me and throwing himself on the floor, or he bangs his head in the door or on me. And then I think there's more further down, but maybe not.
Yeah, and I need to, if you could, Erica, explain to us a little bit more about when you say he pulls on them. Like, can you give him, let's say, a shoelace or some version of a shoelace, which is something that is just his? And is it possible for him to, whenever he has this need, to pull on something that he kind of takes it out of his pocket and he just like plays with it for a little bit and puts it back? If you could explain to us kind of how he does that. Now, putting stuff in his mouth is a very different behavior. Like, this is what I mean. Like, we always have to separate the topographies of behavior. And like, you know, we definitely don't want to allow him to put it in his mouth, but we do want to allow him to functionally use that in some ways if that's something that he needs. I mean, you know, I come, because I'm from the Middle East, I immediately think of beads, you know, that men hold in their hands and they play with all the time. So I'm just wondering if you can describe this behavior, whether we can find something functional adaptive that would be acceptable and that would help him contain it to a certain period of the day or a certain amount of time during his activities.
She clarified he takes his shoes off, or when he has his shoes, he just loves to pull on the laces and chew them or plays with the cords and laces with his hands.
Okay, so that's a different issue, right? So I suggest that you try this, which is give him a shoelace, which is not on his shoes. And I also recommend that maybe for a little while you buy him Velcro shoes so that it's a clear distinction for him that he's not gonna, he needs to forget about going down to his shoes. You do not want to allow him, obviously, to put those in his mouth. So you just stop him. That's called blocking. And you reward periods of time that he goes without putting those in his mouth or pulling them. Now, meanwhile, if he has some item, he could have like a toy shoe or something that has a, you know, he's playing with it in his hands as opposed to his own shoes, and then he is compliant with regards to putting it away, that's totally fine at this point.
There you go.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.